nous avons n'importe quelle question, pas hésiter. Donc, on va le prendre une dehors et comme ça, moi-même, je vais traduire.
I'm on day 36 or something like that. So we're just over 1 month into our new administration, and it's been a very, very busy one. I'll give a high-level summary right now, and then we can get into details with questions. Big picture, we have made some big steps forward in terms of addressing the crises centered at Mass Ave and Millor Boulevard around homelessness, substance use, and mental health. We have made some announcements on removing barriers to public transportation access, particularly for fare-free public transportation. We have this week announced plans to implement a proof of vaccination requirement to keep workers and our community members safe across the city, including in the businesses in our communities, as well as here at City Hall. We've also, thanks to Dr. Ojikutu's leadership, been distributing thousands of test kits for COVID-19 all across the city through our Boston Public Schools, Boston Housing Authority, our libraries, our community centers, and more. We've also made some progress already in taking a big step forward for equity in city contracting with an ordinance that was passed around creating a sheltered markets program that I know Chief Idawu will talk about. And we've also signed legislation now on climate justice that removes the city's investments from fossil fuels and other harmful industries like private prisons and other harmful industries. And additionally today, signed a zoning amendment that would remove parking minimums for affordable housing so we could move affordable housing development through faster in the city of Boston. It's been a very, very busy time. We are very much still building out our team, announcing new cabinet members and making key hires across the city's organization. So this is a time where we really urge anyone who's interested in serving and being part of this moment in our city, please join our team. There are many, many vacancies all throughout our city organization that help us deliver city services and help us plan for the future. I'll just close by saying, you know, as a mom and in this holiday season, it's been so humbling to get the chance to feel the energy of residents all across Boston. I keep telling our cabinet and departments there are 3 ways in which we are going to be building our administration and connecting with our communities and neighborhoods. The first is that city government has to do the big and the small, but we can only do the big things by getting the small things right. Being responsive, being present, and making sure we are meeting the needs of our residents. The second is that our goal will be to get City Hall, out of City Hall, into our neighborhoods. There are many, many tables where important conversations are happening, and we are pulling up more and more chairs to those tables, but the most important, the most transformative way is to pick up the table altogether and take it into our streets and our blocks and where our communities are already organizing. And third, last but not least, is to truly embrace the possibility of Boston and of our city government by not being afraid that we have to do things the way they've always been done, but really taking the actions that our communities need and deserve in this moment. So, very thankful to see you all. I'll pass it on to our Executive Director of the Boston Public Health Commission, Dr. Bisola.
Thank you, Mayor Wu, and thank you everyone for coming today. I'm really, happy and excited to get to know some of you all. I know I've seen and talked to some of you all in the past, so it's good to see you. I am the Executive Director of the Boston Public Health Commission, and as Mayor Wu mentioned, we've been very busy in the last several weeks, months, really focused in on what's happening in terms of COVID-19, but certainly also focused in on what's happening in Mass and Pass, and certainly all the other public health issues and important areas that I know you all and your communities are very focused in on. Maybe what I could do is just give you just a little bit of brief on COVID-19, and do you want me to pass it back to you to talk about the indoor? Okay, great, perfect. So I think that it's really important that we be very clear in our health communication. And I feel like that hasn't happened as well as I would have liked it to throughout the pandemic. So let me tell you what's happening with COVID-19 right now. Currently, nationally, locally, here in Boston, we're in the middle of a surge. And we have increased COVID-19 cases, significantly increased COVID-19 cases. Over the course of the last 2 weeks, our number of cases has increased about 90%. Our positivity rate is around 7%. This is much higher than it's been in the last 2 months, and it's incredibly important that you be aware of that and be mindful of the fact that masking, indoor masking in particular, is incredibly important, as well as vaccination. The other piece that I think is important is our hospitalization rate has gone up significantly, almost 60% in the last 2 weeks. That's important. Obviously, we need to be mindful of the fact that we have to protect our precious resources, particularly in the setting of this new Omicron variant. So a couple of weeks ago, we probably heard a lot about Omicron, and around December 14th, 15th, we found out that there were several cases in Boston, and now you probably heard that Omicron is now the dominant variant across the United States. So what does this mean? Well, Omicron is an extremely highly transmissible variant, which means that we are going to see more cases and more breakthrough cases. Breakthrough cases occur even when people are vaccinated. But what we believe is the case is that if we are vaccinated, if we continue to promote vaccination across our city, we won't see extremely increased cases that are severe. We won't see an increased death rate. So that is what we're trying to promote through all of our efforts to get people vaccinated. Right now, across the city, around 68% of people are fully vaccinated, and that's good compared to other cities, but I believe that we can and we must do better than that. And particularly in the case of, in the setting of Omicron. Over the course of the last couple of weeks, what we've seen is there's been a decrease in the number of new vaccinations. So a lot of people are not rushing out to get vaccinated. We've sort of hit a point where we've hit a little bit of a wall. And so any policy that we put in place, the primary purpose is to get more people vaccinated. We want to protect ourselves, we want to protect our communities, and we want to, protect all of our resources. Like I said, our hospitalizations, and keep people out of the hospitals. So that brings me to the indoor vaccination, proof of vaccination requirement that Mayor Wu announced a couple of days ago. So this is the Be Together initiative. And the purpose of this is, again, to promote vaccination, but it's also to decrease risk in, settings where we know people may go unmasked, or they're very crowded. They're very much so crowded in a room. So it's really about protecting ourselves. The three types of venues that we are putting this proof of vaccination requirement in place for would be recreation centers, so entertainment venues, restaurants, and also in gyms. Okay, so three primary venues, but these are not essential places. They're not like, we're not trying to cut people out from going to the grocery store, doing the daily activities of life. We're really saying that, look, these are the venues where we think there's high risk, we think that people will go unmasked. We're trying to make this as easy as possible for people. So we're not expecting people to produce IDs, no photo IDs are required. Really, what you need to do is just bring your vaccination card, your paper vaccination card, or you can take a picture of your card and have it on your phone. You could also use any immunization record if you can't, you don't have your card. So it's intended to be low yield. We'll also at some point develop an app that would be useful for those of us who have smartphones. But even if you don't have a smartphone, you don't have to use technology, you can just use your card. So our plan is for this order to go into effect on January 15th. Now that means that on that date, individuals 12 and older will be expected to have 1 dose of a COVID-19 vaccine. By January 15th, the expectation is that they will be expected to have 2 doses. And that means that they will be showing that, as I said, as proof at any of the 3 types of venues that I've mentioned. We are also going to phase in younger individuals. So by March 1st, we're expecting that anyone 5 and up would be able to show the proof of 1 dose of a COVID-19 vaccine. And then by May 1st, 2 doses. So it's a staged approach over time. And the reason why it's staged is because it gives people time to get vaccinated. That's the goal here. We're not trying to penalize anybody. We want to encourage people to get vaccinated to protect themselves and to protect other patrons at these venues. So I'll stop there. I also want to talk about the rapid test kits, because I know Mayor Wu mentioned them, and it's really been an exciting initiative. So the government, the state gave us approximately 500,000 kits that we've been distributing. We've now been able to disseminate through a number of different sources, 340,000 of them, and that's happened literally over the course of the last 3 or 4 days. So this has really been an amazing undertaking. Essentially what we've done is we gave a large proportion to Boston Public Schools because we want to protect our schools. We want students to use them before they come back to school after the holidays. We gave them to Boston Public Libraries to make them accessible to people. We also gave them to the community centers and to a host of community-based organizations to make sure that this particular mitigation strategy, this strategy, rapid antigen testing, is accessible to all. We've probably all seen on social media lots of people showing their negative tests, but that's not everybody who's able to go into a Walmart or CVS and purchase a $30 test kit. Now we have the free test kits that allows everybody to use this particular strategy over the holidays. So though our supplies are currently running low because we've been getting them out there as fast as possible, we're hoping for more, and I can provide you more information after this meeting to make this clearly available to anybody who you're interested in getting this information out to in your communities.
Thank you so much. Chief Ojikutu has been incredible and working on so many different initiatives, and I just couldn't be more grateful for your leadership and your work. I will pass it over to our incoming Chief of Economic Opportunity and Inclusion, Shagun Ido.
Well, good afternoon, everybody. Good afternoon, everybody.
Good afternoon.
Well, as the Mayor said, my name is Shagun Ido. I am proud to be the incoming Chief of Economic Opportunity and Inclusion. And the reason I'm here, even though the beginning of that was incoming, is because there is no start date or end date to public service. And so the job of this cabinet is too important to wait to come in on January 3rd, but rather ensure that our cabinet is working very hard to protect our small businesses and our workforce. So I just want to say a couple of things. I'm the grandson of a preacher, so normally we talk for about 30 minutes, an hour, but I know that we don't have that kind of time this afternoon. But I just want to highlight 2 things that were brought up by Mayor Wu and Dr. Ojikutu, ways that we are supporting our small businesses, which is vitally important, particularly in Black and brown communities, because they are the lifeblood of our economy. The first is the pilot sheltered market program, which is going to allow the city to identify up to 6 contracts between now and June 2022 and prioritize women and minority businesses for those contracts. This is a major step forward in the life of this supplier diversity issue here in the city. This is something that Mayor Wu championed during her days in the council and which she prioritized in the campaign. And the minute she came into office, ensured that we were immediately acting on this. Because as we know, in previous times, the city has not done enough to do business with our businesses. And so we're really excited, the members of our cabinet, to work on identifying these contracts, promoting it to women and minority businesses, and making sure that this city is investing in our small businesses. The second way that we're supporting our small businesses is what Dr. Ojikutu just shared with you, which is the vaccine mandate. The best way that we can protect our small businesses is by ensuring that the people who are working there and who are entering there are healthy. And so this vaccine mandate is something that small business owners, with my role previously at the Black Economic Council of Massachusetts, have been calling for. They wanted to ensure that the city was putting this mandate on businesses rather than a hodgepodge of businesses making the decision for themselves. This ensures that the city is going to be providing resources, that we're going to be providing necessary information to small businesses and entrepreneurs, and ensuring that we are protecting, again, our workforce and our businesses. The way that, it's important, the mayor has been prioritizing equities from the moment that she came into office, and so for the vaccine mandate, equity is laced throughout this process, ensuring that the information is easy to understand, easily accessible, and beginning in January, because the mayor prioritizes collaboration, the Economic Opportunity and Inclusion Cabinet will be collaborating with Brianna, Millor, Chief of Community Engagement, and many other city departments to begin walkthroughs through our Main Streets districts to share this information, because we know that when it comes to equity, there's a huge digital divide, particularly in communities of color. And so we know that not every business owner is going to be able to access that information online, to be able to print out the sign and put it in their window. So we're going to go to the business owners. and provide that information, provide those signs to make sure that they can fully comply with this mandate. So, like I said, I'm the grandson of a preacher and the son of a preacher, and so everyone who knows me knows I like to walk around with a bunch of proverbs and sayings. And so as I think of what this cabinet is going to focus on and how we're going to carry forward the agenda and the vision of Mayor Wu, I think of one proverb that says that if you want 1 year of prosperity, grow grain. If you want 10 years of prosperity, grow trees. But if you want 100 years of prosperity, grow people. And the priority of this cabinet, of this administration, is going to be to grow people, to ensure the future prosperity of our great city for many generations to come. So thank you all very much, and looking forward to this conversation.